Now we will see the pituitary gland, its hormones and functions. Pituitary gland develops from the hypophyseal bud and neurohypophyseal bud. The hypophyseal bud is also called Rothke's pouch, which gives rise to anterior pituitary gland, and the neurohypophysis produces the posterior pituitary gland, which is suspended from the hypothalamus through the stalk, which is placed in the pituitary fossa. Now, looking at it closely, the hypothalamus which have two nuclei, parametric nuclei and supraoptic nuclei, with a lot of other connections. And here, from here, we have a communication through the stalk where you have also the portal system, which is nothing but the venous plexus, which brings all the releasing factors from the hypothalamus onto the pituitary and anteriorly and posteriorly. Anterior gland secretes about 5 different types of hormones, and posterior secretes 2 different type of hormones, which we will see now. And you can imagine that the hormone, the stimulus or releasing factor like dopamine agonist, which is strong. Normally, prolactin is being inhibited from the being pumped. Now it is being disinhibited by the prolactin. So, secreting cells secrete. Now, TRH or thyroid releasing hormone, which reaches the particular cells in the antipituitary to produce thyroid stimulating hormone. Yes. And now you see the corticotrophin releasing hormone or adrenal axis, which is responsible for the secretion of adrenocorticotrophic hormone from the antipituitary gland. And gonadotropin releasing hormone secretes stimulates two different cell types to produce FSH, that's called follicular stimulating hormone, to stimulate the gonads, to produce ovum and sperm. And now gonadotropin releasing hormone intermittently stimulates the LH secreting cells, which produces luteinizing hormone from both men and women. Now, growth hormone releasing hormone is a potent stimulant to produce, the growth hormone from the antipituitary. And the posterior pituitary has no stimulatory function, which stores the cells to produce ADH, which is secreted from the neurohypophysis, which is being directly stored in the posterior pituitary. Again, similarly, oxytocin, which is secreted from the hypothalamus and comes and stored in the posterior pituitary to be released into the blood as oxytocin, which is responsible for uterine action and expression of milk. Now, all the hormones are peptide hormones, and they are transmitted into the bloodstream, either the bound form of the proteins or unbound form, and reaches the target glands like thyroid, adrenal, gonads, etc. And it finds the G protein coupled receptors, which is the receptor which responds to the peptide hormones, are all pituitary hormones. And you see alpha, beta, gamma proportions, and then it works with the adenyl cyclase receptors and activates the cycle KMP, and then it does the effector work by opening the gate channels, and subsequent cellular functions are mediated from the thyroid, adrenal, etc., etc. And peptide hormones are pituitary acts through the G protein receptor couples. All are peptide hormones. Almost all of the pituitary hormones. Now the physiology, you see the anti-pituitary secretes around 5 different hormones which I said. The prolactin, responsible for milk secretion, thyroid secretes T4 and T3 upon stimulation of TSH, and adrenal secretes cortisol and aldosterone by the ACTH stimulation. Ovary secretes estradiol and also produces ovum, and testis secretes spermatogenesis, that's FSH, and LH is responsible for the testosterone production and realization. Growth hormone promotes linear growth. Now you see the posterior pituitary secretes vasopressin and antidiuretic hormone, which acts on the V1 and V2 receptors and by causing vasoconstriction and increased water reabsorption by maintaining water volume and blood pressure. Upon stimulation of hyperosmolarity, parasympathetic firing, angiotensin 2, and increased sympathetic tone, etc. So, we have to assess the functional status of the pituitary now. That's the clinical aspect. You have to do basal levels of growth hormone, adrenocorticotropic hormone, TSH, prolactin, LH, FSH, etc. And then after stimulating with insulin and TRH. To conclude, hypothalamic releasing hormone influences pituitary, and pituitary influences target glands, and it acts to the G protein coupled receptors. Pituitary function testing will help the clinician to diagnose the functional status of the pituitary. Thank you for watching. Thank you.